Thank you for joining us. I would love to introduce you to Michelle Cockram, the pelvic goddess. And Michelle is the clinical lead in Northamptonshire as a pelvic health physio. And we were having a conversation, wasn't we, Michelle, about the need for more pelvic health physios and how can we help this while we're waiting and recruiting more pelvic floor health physios to actually maybe upskill health professionals so that they can then see when issues are going on, they can refer, they can give basic advice. And I'd just love you to share your thoughts on all of this.
Definitely. So basically, I work with MSK Physiotherapists within their team. And whenever I do training, I'm always trying to get them confident with identifying patients that have pelvic floor dysfunction, because every day they're coming across postnatal women, menopausal women, men that may even have prostate cancer. So they are in a perfect position to ask the questions that then could lead to that person admitting they've got some pelvic floor dysfunction, getting some basic treatment, because not everyone needs, not everyone's got moderate to severe problems. Some people have just got mild problems. And as we know from research, 86% of patients, or women in particular, got better and their problem resolved after 6 sessions of physiotherapy. So a lot more people can be picked up. And of course, the thing we've got to remember is, because there isn't enough pelvic health physiotherapists, we've got a long waiting list thanks to COVID, and lots of people on that routine waiting list. So anyone, if an MSK physio, and when I say MSK, I mean musculoskeletal physio, is treating someone for their shoulder or their knee even, and while they're questioning, they ask about their bladder and bowel, and the person says, well, actually, yeah, I do leak urine when I try and do exercise, and that's kind of put me off going to the gym. That's the perfect opportunity. If that physio has the confidence and the knowledge of how to not just teach someone to do a Kegel, because we don't just want people to learn to engage in pelvic floor in isolation. We want proper pelvic floor muscle training, because we know that's what works. And Louise's training is all about that. And that's what I loved about her. I met her first on Pelvic Raw, and I've seen that she has all these amazing gadgets that everyone should have. And explaining diaphragmatic breathing and abdominal breathing with one of these is so useful, having those visual cues. And I think making it fun, making it lighthearted really helps, because, generally when I've spoke to musculoskeletal physios about this, they feel embarrassed. They don't really know how to approach it. So by having this kind of input of something like Adore Your Pelvic Floor, it's a no-brainer, because it gives those physiotherapists that aren't trained this at degree level, they become qualified physiotherapists, but I think there's like a 1 hour training session when I did my training on pelvic floor. So they really do need this upskilling. And we've also got in the NHS 10-year plan now, this wonderful rollout coming next year, 2023, of much more women being offered pelvic health physiotherapy after they've had a baby, which is something I'm so happy about. But we've got to think, right, how are we going to cater for that? And are we going to have enough pelvic health physiotherapists to give those women that service they deserve? And it might be that in the meantime, the NHS physios, the MSK ones, can give this kind of quality input and feel confident to train patients with the basics, and that might be enough for a lot of people, and then signpost on to people like myself and all the other wonderful pelvic health physiotherapists out there for those that don't progress with the basics.
Yeah, absolutely. And as you say, it's the confidence. When I was with you, I had the joy to be with your team the other week. It was the fact that having that confidence, because when somebody comes in to the clinic, because they are in a professional health role, that is the perfect opportunity where the gentleman or the female may be actually asked for the first time ever, how is your pelvic floor health? How is your bladder health? How is your bowel health? And actually the patient is going to be really honest, because they're in that medical environment, aren't they? And that would be a gem for people to have that question asked, because it doesn't often get asked.
And also that physio knows how to approach it. For example, I did some training this week, and I was saying, if you've got a male in front of you that's got, a knee problem or a shoulder problem or whatever it might be, low back pain, we know that 97% of patients, when we look at research, we've shown with low back dysfunction to have pelvic floor dysfunction. So they're coming in through the physio's doors. So yes, we do need to be those people and asking those questions. And things like prostate cancer, if a male is 60 or above, particularly if he's a black male, if there's a history of breast cancer from their sister, or their father or brother has prostate cancer, the risk is much, much higher. So, I just want those seeds planted in those physiotherapists' heads, so that they are already thinking when they've seen their new patient referral, I must remember to ask that. Or even when they talk about, how are you sleeping? If that patient then brings up, I'm waking loads these days. In the last 6 months, I'm peeing 4 times a night. Bang, they've picked up that that's not okay. Frequency is a red flag. We need to ask more here, get them back to their GP, get the tests done, or even just have a chat with a pelvic health physiotherapist. So they might not have loads of knowledge, but enough to think, I need to ask more about this, and that will make me very happy. And it's going to give our patients the best outcome. So another thing I'm passionate about is menopause. So I'm now 5 years into menopause, the gift that is. And I want the physios to know when they've got a female in front of them that looks what we call dementia sometimes, those patients that, you've only got 45 minutes to an hour to assess, and they've got so much to say because their whole life has changed. And for 40% of women, they get severe menopause symptoms. They don't even know what's going on half the time. And if that physio is the first one that says, can I ask how your periods are? And then identifies that woman may actually be perimenopausal or menopausal, that could be the moment where she gets the help she needs and gets her life back. And then us as physios get the best outcome for that patient. So, for me, that's what Odori Pelvic Floor Training is all about. That, I'm busy, I'm a clinical lead, I've got a lot to do. So having someone like yourself, Louise, run something like Odori Pelvic Floor has been a breath of fresh air, because you make it fun, you use your wonderful visual cues, and also you're such a massive heart, and you tell people about what your personal experience has been. And that's much more powerful than reading a book, or just seeing a presentation, because it stays in people's thoughts. And then it makes it more of a consequence. And you can see, actually, this gorgeous woman looking fabulous here, she's been through this, and look at what she can do. So it's, for all those people that are worried to leave the house, are scared to do exercise in case it makes their symptoms worse, you're a brilliant role model. And that's what I want physios to see, and equally, I know it. So in my job, I see it all the time. And that's why physiotherapists like myself and pelvic health, we love our jobs, because the most powerful thing you can give someone back might be their sex life, their continence, reduce their prolapse symptoms, be the one that tells them that they need to get checked out and have that. I mean, the boxes of biscuits you get, the chocolates, the flowers, it's all fabulous, because it's such a rewarding role. And that's why I'd love as well more physios to think about becoming pelvic health physios. It's not all about internals. And that's the other thing, is that when I think about why people don't want to do pelvic health physio, some people just can't imagine they're ever going to want to do internal examinations. But your course shows exact example of there's so much we can do that doesn't involve an internal examination. Just being able to palpate above the pubic bone and palpate around the coccyx, so the person has that feedback, can give them so much empowerment. So when they go home with their exercise, they're not thinking, am I doing it right? I have no idea. So they're more likely to do their exercises properly and can keep doing them because they know they're doing them right. And that's a big problem with pelvic floor exercises, because you can't see your pelvic floor.
Yeah, absolutely. And I think what you've just mentioned there is just this collaboration. We need a team of people, don't we? From the exercise instructor that has got training to recognize from the outside, because so many areas of the body can affect the pelvic floor group and their function, from your feet right up to your jaw, to your brain, to how it's talking to your bladder. So there's so much on the outside, and there's so many highly trained exercise coaches. And they can incorporate this, because like yourself, we don't often get the training in our basic education. And that's the other thing I think you and I would love to see, is more pelvic floor health in basic training as a standard for MSK physios, for chiropractors, osteopaths, movement coaches. We need it as a standard. So then it's recognized more generally, which means it's going to be talked about more generally, which means then we can then gain a team locally to us where we can refer and signpost all of the time. That would be the gem, and it's there. is there at our fingertips. We just need to bring it together.
And if you want to get your management on board, have a look at the nice guidelines, those gorgeous, nice guidelines that came out in December for pelvic floor dysfunction. It says in black and white, work with your, your fitness professionals. I've got a fitness professional close to me, and she is amazing. I went to her talk on the weekend and she blew my mind, because we can't know everything. We can't reach everyone. We can't do everything. We just haven't got the time and the resources. But yet we've got amazing fitness professionals around us who are doing breath work, who are doing scar work, who are doing post-natal rehab. We need to be communicating with them, the midwives, etc., because we should all be singing from similar hymn sheets so that people are, getting it right. And then all those people out there are going to have much healthier pelvic floors and continence.
Yeah. And with the movement coaches, because obviously that's where I come from, we are really good at teaching a move that people can't grasp. So we've all had somebody that can't do their lunge or can't do their squat, or having trouble with that, or their technique isn't correct. And we just understand how to break it down, because that's what we've been trained in. Whereas we can't do an internal assessment, but you can. And this is where that passing over gives the best result. So that is just awesome to hear, and we're all about collaboration, aren't we, Michelle?
Yes, and equally for all us pelvic health physiotherapists don't get time to look after stuff, that we can then become friends with those fitness professionals. They can help us. It works both ways, isn't it? That using that trampette, Louise, for getting people better at rebound, etc. This is all golden things. Physios have trumpettes, throughout the department, and it's being aware that if someone says to you, "I really would like to be able to do a star jump, and that's the one thing I can't do," that it's not. In the old days when I first started out 13 years ago, you were told, "Well, don't use a trampoline, then don't run," and that's such a shame. That's not what's happening now. We're empowering people. If you want to do something, we can make it happen. It could take 9 months to a year. It could take 2 years, and maybe it might not happen for everyone. But with the combination of us doing that initial part that they need to get them to a point where they've got normal pelvic floor strength, and then you give them the coordination, the timing, so that they can continue to increase that pelvic floor muscle strength. And we know now that weights are really, that's in the nice guidelines, isn't it? That weights with pelvic floor muscle training has been shown to increase muscle strength. So the world's our oyster. Thank goodness.
It's that functional movement, because we don't lay in bed all day, and we don't want to lay in bed all day, and we want to increase the range of choices within our life, not reduce them.
Yes, and it's the same with, if we treat, again, me banging on about shoulders and knees, you would never treat a shoulder patient and just assess them lying down. You've got to look at them standing. You've got to look at the timing. You've got to look at their capacity to do things, because that's the problem with injury or any change in function, is that you lose that proprioception. The conversation between the brain and the area changes. You have to relearn it, as frustrating as it is. The pelvic floor is just another muscle, so it's so important that everyone hears that and learns that it's not just about learning to lift it and relax it.
And it's not scary to teach.
No. And actually, we are in that generation, aren't we, where actually more and more people are so much more open. Like, for example, fitting pessaries. In the past, women would never have dreamt of putting a pessary in and out themselves. Whereas the majority of my patients are young mums saying, "Do you know what? I don't care. As long as it helps me," and, describing it a bit like a sports bra, that you can use it as and when you need it. That's the kind of mindset we need, rather than this. It's so emotional to find out people have got a prolapse, and to reassure them, 50% of women have got a prolapse. There's so much you can do. Get yourself some EVB sport, amazing shorts. Get yourself a pessary should you need it. Manage your constipation. All these things. You know what? You don't have to be a pelvic health physiotherapist to tell someone that. That's something that fitness professionals, physios, and of course, if they're not improving, we do know about overactive pelvic floors or hypertonic pelvic floors, and they're the people that could do with the specialist input, particularly because they need to learn how to down train. But equally, someone like yourself that's so knowledgeable, you might have someone in your class that just says, "This is making me uncomfortable." You've got the wisdom to say, "Let's do some breath work with you," and that's, very similar to what physios would do, but we may do it with more biofeedback because we've got the capacity to do the internal stuff. But that can make all the difference in that moment. That person believes, "I've got hope, I could do something about this," rather than think, "This is me, I can't change it."
Michelle, I'm just so delighted and feel honoured to have met you, and the work you are doing is awesome. And your clinical lead role, I know, makes a huge difference to your team. And I just want to thank you. Thank you very much.
Thank you, Louise. That's lovely. And yeah, like-minded. I'm so grateful that Pelvic Raw put you on that day. So I got to see you in action.
Well, darling, all my love, and we will both keep on banging on.
Yes, we'll start with our curly hair. We're going to start a pelvic health band.
Sounds good to me.
Take care,
Bye-bye,
Louise.
darling.
Bye.